Hello everyone. In this video, we are going to talk about a 20 years old girl presented to the hospital with palpitation and tremors. Okay, the case study already posted in the Instagram page easymedicine003, so you guys can actually go through it before come to this video if you haven't go through it. And so I've already posted the differential diagnosis in the post as well, because the girl is actually has a known history for type 1 diabetes mellitus for 8 years and thyrotoxicosis for 2 years. So for the current presentation with palpitation and tremors, our differential would be, the first one we can say maybe an uncontrolled glucose level, maybe can relate as diabetic ketoacidosis. Okay, second one could be focused on relapse thyrotoxicosis, because she is on medications for the past 2 years. Maybe it's a kind of relapse condition now. And then third one is a thyroid storm. Okay, it's a kind of a critical condition. So these three should be in our mind when the girl actually got these two histories: type 1 diabetes mellitus and thyrotoxicosis, and currently presented with palpitation and tremors. So for the focus questions regarding this palpitation and tremors and associated severeness and symptoms as already asked in the post, so we can review it as well now. So moving forward to the risk factors. So what are the risk factors could cause this DKA, which I mean just now, the uncontrolled glucose level in a body, and maybe thyroid storm. So the symptoms and risk factors for this one and this one is kind of quite similar. So if you guys focus here, the risk factors for both this condition, the first one is infection, maybe second one is stress, and third one is untreated condition, both in DKA and thyroid storm as well. Untreated, which I mean like glucose was not in control, and for the thyrotoxicosis, maybe it has not been treated in the past condition. And fourth one would be maybe the girl has gone through thyroidectomy. We have not sure, we need to ask the patient, so this one need to be a risk factor as well. So moving forward, the kind of questions we need to ask in patients with in diabetes mellitus. So in this patient it is type 1. So what we're going to ask is about mainly the first diagnosis of diabetes mellitus, when was done and where, what are the symptoms which make her to actually went to clinic, and finally they got to know about the type 1 diabetes mellitus, and what are the treatment was given during the first visit, and current medication she has been taking on. And then we need to ask any complication of this type 1 diabetes mellitus previously. So usually in type 2 there'll be micro and macrovascular complications. So maybe we can actually, in this type 1, maybe we can actually we can ask her about the complications of the other systems as well. And then for the severity, previously we can ask, previously she has been admitted for any DKA conditions, uncontrolled glucose levels in her body, or so on. And compliance, she taking the medications properly according to the prescription and so on. And then how she monitor a glucose level. So that's how we're going to ask about this type 1 diabetes mellitus. And then the next one is thyrotoxicosis. So it's actually same as for the diabetes mellitus as well, because we're gonna ask about the first condition and where was done, what are the symptoms, any treatment has been done or any surgery has been done, and complication as well, the severity usually thyroid storm, and the same thing, is she compliant to the medications or not. Okay, these are the common questions we need to ask patients, because as I mentioned just now, the differential diagnosis for this condition, because the girl has these both conditions, so we need to check for the glucose level, or relapse thyrotoxicosis, or maybe thyroid storm. Okay, moving forward to the physical examinations, what are the signs we're gonna see in this girl? So for focus on diabetes, actually I'm preparing another video. We can focus on diabetes, just only diabetes, and for now I'm just actually included a brief idea what are the signs we can see in this patient. So we are suspecting uncontrolled glucose level, which may really which may lead to DKA. So we can check for the hydration status, because usually the patient would be dehydrated, and then BP, heart rate, pulse rate, temperature, and oxygen saturation. And then is there any presence of Kussmaul's breathing, tachycardia, and hypotension, and fruity smell breath. These are the signs for DKA. And then for the this thyroid storm, they have this Corbett worth of sky. So based on this scoring, they actually diagnose the condition, whether it's a thyroid storm or not. So all this comes under the physical examination: the temperature, CNS effect, any effect of CNS, hepatic dysfunction, jaundice, she having jaundice, tachycardia, is there signs of any congestive cardiac failure, atrial fibrillation, and precipitin history. Precipitin history is actually the main is the risk factor: infection, stress, or untreated. Yeah. And then for the thyroid, actually same like just now, like diabetes, I've planning to do another video. We can just focus on neck swelling. So in for thyroid, because it's like a relapse condition, maybe we can actually redo this physical examination to look for the swellings. And then we need to do a general diabetes examination as well, from head to toe, because the diabetes involves the whole body, the general system. Okay, these are the signs we need to elicit in the patients with this condition. So moving forward to the investigation, as I mentioned, actually these are kind of critical conditions, because we need to act quickly, because maybe there will be many severe complication may be running on in this patient. So we need to do several investigation. The first one would be full blood count. In this blood, we check for any WBC, signs of infection, and then the glucose level, is it like in normal rate or elevated, and HbA1c for the past 3 months, how was the glucose level. Atrial blood gas, look for any ketoacidosis, and then acidosis, metabolic acidosis, and ketone level in the body, bicarbonate level. And then we need to do thyroid function, because one of the differential is actually relapse thyrotoxicosis and thyroid storm. We need to do renal profile as a baseline, and also to rule out this diabetic condition, and liver profile, because this thyroid storm may affect this liver. Cardiac biomarkers, both this blood, the glucose and thyrotoxicosis can affect the heart, so we need to check it well. And we need to do ECG as well, and then thyroid scan to look for the thyroid swelling, and then blood culture if there is any infection, so we can check for the causative organism, and then we treat with antibiotics. And for the management, once the patient has been diagnosed, according to the type of pathology has been running in this patient, as we suspect either maybe uncontrolled glucose level, may lead to the DKA or thyroid storm or relapse thyrotoxicosis. For the uncontrolled condition, we can actually treat with an immediate insulin as a insulin supplement, and along with metformin. And then for the lifestyle management, we can actually advise a patient, and we suspect for the DKA, maybe we can proceed with the DKA management. There's a separate management we can discuss in other videos. And for the thyroid storm, if we suspect according to the score just now, so we start with an immediate IV fluid and beta blockers, digoxin, anti-thyroid medications, hydrocortisone, and tepid sponging for the fever. And for the relapse thyrotoxicosis, so we have diagnosed if she's having a relapse condition, we start with this radioiodine therapy, which means like she's not been she cannot be treated with an anti-thyroid. So we actually evaluate the patient before giving this radioiodine therapy and after giving it. And usually in these relapse conditions, the first line for all relapse condition is actually radioiodine therapy. And if we need to do surgery, it is a must for her. Maybe we can proceed with the thyroidectomy. It can be a partial or total, and yeah, we need to prepare the patient before the surgery. And that's all about all these discussions about patient presence with palpitation and tremors. That's all. Thank you.